My name is Nick Bailey, the Online Education Manager here at CWA, and today's webinar is brought to you by CASA and CWA. The next slide, we'll talk a little bit about contact hours. We are issuing contact hours for today's webinar. You will see a 4-digit attention check code on the top left-hand of the screen, slide of the screen later on in the presentation. Please do note that attention check code. And on the next screen, we'll talk about the process that you'll need for claiming your contact hours. You'll just need to go to log into https:/oncwa.org under the Contents tab. You'll be able to enter in the 4-digit code there, and your contact hours will automatically be uploaded in your MyCWA account. On the next slide, there will be handouts available from today's presentation. Those slides will be available on also within ON under the Contents tab. And there will be a slide that says handouts, and the slides will be available there after today's presentation, actually when the recording is available, so in about a week or so. And on the next slide, I think it's my final slide, it's just a disclaimer. I will not read it, but the last piece that I will say is just for if there are any reporters on room, all of our speakers today are off the record. And with that being said, I'll go ahead and turn it over to our partner, Spencer Sachs with CASA. Thank you.
Awesome. Thank you, Nick. So thank you all so much for being here, and thank you again to CWEA for partnering with us on this. And huge thank you to the CDPH team for giving us their time and working with us to put together this event. So this event is the second webinar in our 3-webinar series talking about wastewater surveillance and public health, and providing just kind of a wastewater surveillance 101 for kind of where the program is at, where it came from, and where we are now. This particular webinar is focusing on specifically from our title is From Sample to Signal. So we are talking specifically with the lab community and the with the CDPH team. And so we greatly appreciate it. The first webinar helped kind of provide some success stories from the program, talked about kind of where we came from and where we are now. That webinar is also available via recording. So if you enjoyed this one and weren't in attendance for the first one and would like to be there for that, that recording is available on CWEA's website. And so our speakers today that we have from the CDPH team is Chunye, Birdie, Bridie, sorry, and Jessica. And I will first hand it over to Chunye to get us started.
Thank you, Spencer. So, hi everyone. Thank you for joining us for today's webinar. And as Spencer mentioned, my name is Chunye. And today, my team from the State Lab will walk you through our laboratory procedures for wastewater surveillance testing, demonstrating how we process wastewater samples to produce surveillance data from the moment we receive the samples to the final reporting of the data. Before we proceed, please note this disclaimer. The views presented in this presentation are solely those of the presenters and do not necessarily reflect the opinions and positions of any other individuals or organizations, including CDPH. So for today's presentation, we will provide an overview of the laboratory methods, discuss packing and shipping best practices, and why proper handling matters. We will end with voice from the field and Q&A. So now let me walk you through the life cycle of wastewater samples. First, utility collects wastewater samples and send them to our lab. When the samples arrive, we immediately check them in and assessing them. Next, we concentrate the wastewater sample and extract the nucleic acid. And after that, we will do ddPCR to detect various pathogens we are monitoring, and that will be followed with data analysis and review. And after that, all data that passing our quality control will be reported and displayed in various internal or external dashboards. So ultimately, and this this data help inform the public health actions. So now I will turn it over to Brady, who will go over our laboratory methods.
So I'll just give a very brief overview and kind of go over the basics of what our methods include and kind of how we analyze our data and what we're kind of looking for ideal data. So as Chunyi briefly went over the entire workflow, this is kind of our timeline within the lab. So, and of course, this is our goal timeline. Sometimes there's issues. We don't always hit it, but usually we have this as our average. So usually on day one, that's when sample collection occurs. And so the majority of our samples are these 24-hour composite samples, which we'll go over the benefits of these composite samples versus grab samples later. And from here, this will be this 24-hour. And then after those 24 hours, this is generally when the samples will be shipped off to us, and we'll usually receive them hopefully within the next day or two. And so once we receive the samples, we'll accession them. And basically what we do here is we're assigning the sample a unique ID, and that's for us to track it through the workflow and any issues we may have, or anything where we can kind of go back, and if we want to see a trend or we got a positive of a rare event, we can go back and easily track the sample and how it went through the workflow and its controls. But during this time, we also monitor any of the conditions at arrival. So ideally, the sample is below 10 degrees Celsius, and it's also, things are not spilled out. And if there is anything unusual about the sample we observe, we do have norms we see with samples on arrival. Like we'll receive some samples from some utilities that usually have a lot more debris and others that are less debris. And we have sometimes received samples in weird conditions where like this sample is slightly pink. This is where we will record all of that information and get it ready for our workflow. And so that's when we start with our virus concentration and extraction. So basically, we receive 50 mils of sample. 50 mils is a lot to work with, so we want to concentrate this down to a much more workable volume. And we also want to make sure that we are concentrating down the targets we're looking for. So right now it's all viruses. And it's really simple. We just use fancy magnetic beads and it pulls out the virus and puts it into a smaller volume. And then from there, we extract any of the genetic information within these viruses. And so from there, it's ready for PCR. And so we do a specialized PCR. It's called droplet digital PCR. You don't really have to worry about that at all. But that is a way that we can then quantify the amount of that virus that was in that original sample. And so then we'll analyze the data. And of course, this is when we'll kind of figure out how much of the target was in each sample. And then we also will do a lot of QC checks at this point, and this usually takes a few days. And so this is about day 4 or 5 after the start of collection. And then once we have the data undergo all of its checks and it's passed all of our QC metrics, we send it off to our epidemiology team. And from there, they'll do some more kind of analysis of the data and be able to kind of submit it to public dashboards, to local health jurisdictions, and basically we can take public health action if needed. And so this is just going over the benefits of a grab versus composite sample for us. So the grab sample is only at a certain period of time, usually within 15 minutes or so. And it is really good for providing an estimate of concentrations at that moment. So it can be really useful, say if there was a large event going on, like a concert, or, one of the things recently could be like the Super Bowl was in the Bay Area recently, and that's where we are. So in these moments, we can actually see what's going on right at those exact moments. However, it is really time sensitive because it is just an immediate sample taken at that time. So it could be that if we were to take grab samples, we could miss a positive of a rare event, meaning something like H5N1. We might not detect it in that grab sample because maybe somebody had an infection and they went into the bathroom in the morning. At the time, you might not have it in the sample, whereas a composite sample is that 24-hour collection period. So it's really good for high sensitivity. Maybe if there's only 1 or 2 people in the area that have a certain infection, we can potentially grab that in the 24-hour sample. It also gives that really good average, which can allow us for stable trends over time. But you can miss, maybe somebody did travel for a concert and they left, and now we might not be able to detect that, which is where the grab sample can be beneficial. So this is briefly going over the interpretation workflow. We won't go over it too much, just kind of what we're looking for. And so we have multiple targets that we are testing for. And so an example on the right is what the data looks like once we get it off of our machines. And so we have um, 7 different targets we are analyzing, including nine different targets we are analyzing for, including controls, which includes SARS-CoV-2, RSV, flu, and then of course we have H5N1 and multiple Mpoxes, clades that we are analyzing for, and then we have control viruses that we look for as well as a way to measure population and also to measure if we had a contamination during one of our workflows, like whether it was during concentration or extraction, we can measure those as well. So as I mentioned, the samples will undergo concentration and then extraction, and then we run them on PCR. And this whole process will take a couple of days, generally because the entire process from start to finish takes maybe just over 10 hours to complete. And so it's usually done over a period of days, but then we get this output of data. Interestingly, this PCR, all it gives us is these little positive droplets. So these are these color drops that you see on the screen. And then basically from there, we can get a number. So our epidemiology team is amazing, and they have designed a code for us to measure these concentrations and convert these basically little positive points on this data into known concentrations. And that concentration will tell us just how much virus is in this wastewater. And then from there, we're able to do different analyses. We're also able to see our controls. So you can see some of our controls on here. One of these is our BCOV. That is a virus we use to measure how much we're actually recovering because there is loss during this workflow. It's pretty standard that as you manipulate the sample more, you might lose it. And so from here, we can see how much are we recovering. And if it drops below a certain threshold, then we'll have to repeat that sample because we do want to make sure we are getting an accurate number here. And so once we get these concentration calculations, this is when we can send it off to our epidemiology team. And so this is where their expertise comes in. Well, they will use this number to track trends in the community and measure potential risk and also share that information with the CDC and local health jurisdictions that can then make decisions, especially if it's rare events where they might be measuring an outbreak or there's concerns for the population.
And then I'm Jessica, and I'll be taking over to discuss some best practices that we recommend for packaging and shipping of samples. How do samples get to our laboratory? So there's a sample collection step, and then ultimately once we receive the samples in the lab, as mentioned before, we'll accession the samples and give them each a unique ID. I want to shout out that this is the really important and hard work from our utility partners to collect these samples and ship them back to us. So I always like to give a shout out and thank them because we know this is extra work for them. But so, at least on our program, we use 2 different courier services for shipping samples, and those would be GLS and FedEx. So as a program, we provide each utility with about 6 to 8 of shipping kits. And this is after a sample is collected. The sample will be packaged into a shipping kit to be sent back to our laboratory. So in a shipping kit, the first component of the shipping kit is the insulated cooler, along with 2 ice packs. And these are meant to keep the sample as cold as possible during the transit process. Additionally, we provide a bag containing an absorbent pad that we request the sample is placed in. And this is first, in case of any accidental spills, the absorbent pad within the bag will at least contain the spill and preserve the life of the shipping kit longer. And then, as well as each sample will receive a chain of custody form that's filled out by the utility and sent along. And this is also for our record keeping to help track the unique identifying factors of each sample. And as a side note, when we receive 5 to 6 coolers in our possession from the same utility, we'll resume the cycle and ship them back to the utility so we can keep the process of sample collection and shipping going in a routine manner. So for sample submission guidelines, typically what we ask for a utility is we receive 3 samples per week where each sample is collected on a different day. Upon receiving the sample, we want the sample to be less than 10 degrees Celsius and additionally in a volume that's at least 40 milliliters. I know Brady mentioned previously that typically we receive about 50 milliliters and without any leaks. And as mentioned before, ideally we receive the sample within 24 to 48 hours of the collection and ship the we receive it within 24 to 48 hours upon shipping out to our lab. And I want to highlight some things on the COC form that are extra important for us for our record keeping and trend tracking versus when the start of a 24-hour collection began, just so we know the exact date at which that occurred. If there's any unique sample ID, then will help us correlate what we receive to what you're providing. And then finally, this date released, which will help us keep track of when a sample was shipped out and if there are any potential issues from the courier's side, we can at least keep track of when a sample is finished collecting to actually released to be shipped out to our lab. So I presented quite a few guidelines and requirements of what we prefer from samples from the utilities, and to extent it is a lot, but I want to emphasize exactly why we give these guidelines and why proper handling matters. And ultimately, these guidelines are important because in order to provide timely and accurate results to inform public health decisions, we need high quality starting sample material. And as Brady mentioned earlier, we perform droplet digital PCR on our samples, which relies on using the nucleic acids found within the samples to provide estimates of viral concentrations across the state. These nucleic acids within the samples have a tendency, are more likely to degrade with higher temperatures and potentially degrade more if they're maintained in wastewater, since we don't know how good of a preservative a wastewater is for nucleic acids. And for some case uses where having these trends are important over time is we can, from a small scale, we can look at, for example, SARS-CoV-2 levels over time on a shorter scale, which this is in months, to even example, flu A levels across years. So in order to have that data, we need frequent sample collections and high quality sample data. And then, for example, the stability in nucleic acids is super important when it comes to low abundance in rare pathogens. For example, a super relevant one right now is measles, which is both low abundance and rare. And we want to optimize our chances of catching a detection of these rare events, and that requires having wastewater samples sent to us in the most ideal conditions possible to try and capture these events.
So this next section, we're going to discuss from Voices from the Field, where we have discussed with one of our utilities, LACSD, and their experience in the program and any tips and tricks they have picked up over time. So just a little background, LACSD has been submitting samples to DWRL, which is our lab unit, since 2022, and they've submitted us hundreds of samples. In addition, they're also submitting other samples to many other testing labs as well, so they have a lot of experience in this. And over time in the lab, they have learned the benefits of waste monitoring in monitoring of population health, chemical indicators, and high cost effective and non-invasive. Because this way, we're not relying on clinical data, we are relying on population data, and we can see a very clear estimate when, in addition to the clinical data, can give a really good overview of the health of the population. I know a lot of utilities are really familiar with kind of more the environmental monitoring side, but this is an experience we've had on the public health side as well. So next. So the LACSD was actually able to present last week at one of our office hours events, which I know was discussed in the first webinar, one of the resources the program has, which we will go over again later. and they were able to figure out over time different challenges and how they were able to address them. So one of them is they commonly had sampler issues. And so they said when they first joined the program and received their auto samplers, they had no problems. And it wasn't until about 2 years after they had been running these auto samplers that they started to have issues. And so one of the things is, equipment failure can occur. So they found it was really important to maintain and repair these auto samplers whenever possible and to make sure that they are keeping up with them and preventative measures so that they don't break when samples are needed to be collected. They also had instances of incomplete composite samples. So this was often caused by clogged lines or pump malfunction. So once again, related to auto samplers and other equipment. And so they have found, unfortunately, there are problems that can occur that they're not within their control. So the majority of the time, they've been able to just avoid issues by making sure that these auto samplers and all the equipment related are maintained, but they have found that sometimes there's issues that they have not been able to address, and they have found that that is totally fine and just completely out of their control, which is no issues with us as well. We've also had other utilities have the same problems where every once in a while we get an email where somebody has said they are unable to collect a sample that day due to issues, which we totally understand. Another thing is also shipping considerations. So as Jessica mentioned, we have two different couriers that we use. And so if we are onboarding or we currently have a utility partner, we most likely will onboard them with GLS. However, it's not unusual that sometimes utilities will have issues with whatever courier they've been using. And so sometimes FedEx might not be able to reach certain sites, same thing with GLS. And so LACSD found they were originally on GLS and we switched them over to FedEx and they found that it worked a lot better for them because they were able to avoid issues of pickups. And it just seemed that FedEx had better coverage of their area compared to GLS. So that was a really big thing that they have advised, where just finding a reliable courier and partner for them. And we can always help with that as well. They are not the only utility that has had similar issues of shipping where we've had to switch them onto different couriers just to find the best option. The other thing too is they say shipping samples early in the day, and it helps avoid delays and missed windows. For example, you can sometimes just schedule a shipping period to be occurring within 4 hours. So sometimes it's like 8 to 12, or even 1 to 4 or 1 to 5. And so they have found doing it earlier in the day is best for them because it avoids issues with times closing, with their utility closing, which we have found is also similar to other utilities, making sure that it works best with their schedule so that they don't have to go back and forth and make sure that samples are picked up or having to reschedule because it does add more work onto them. And we already know that helping with this program is extra work. So we're trying to make it as easy as possible. So whatever helps for them for that. And so these are resources that were mentioned in the initial webinar that our epidemiology team provided for the program. And so we've just reiterated them here. So just in case people may not have been able to attend the previous webinar, the work group meetings is really useful for a lot of people. That's where our epidemiology team will go over a lot of different trends and share any updates. We also have office hours, which, as I mentioned last week, we had one where LACSD was able to present, and sometimes we'll invite other people. Our epidemiology team will invite other speakers from other states or other programs just to provide a lot of background and ask questions. And then there's an online forum for everyone. So if anybody has any recordings of past meetings because maybe you weren't able to attend one of the office hours and maybe it was another utility speaking about tips and tricks they've picked up like LACSD and you weren't able to attend, you can go back onto these online forums and find recordings and then also offering consultations and site visits. Our EPI team also releases biweekly and weekly reports of different targets. And then there's also, of course, public-facing dashboards that provide information on CoV-2, flu, and RSV. And then there's also different toolkits and FAQs that are offered from our epidemiology team, along with our COE website or our Center of Excellence website, which is been given to us by the CDC, where we run the Western Center of Excellence and help resources for not just California, but also various states in the area. And so once again, this information for the program email was provided for contact information. We also have a laboratory specific email. And so you can contact either or. We will always forward along messages. But if you have anything very specific about the workflow, packaging, shipping, all of that, we'd be happy to answer or at least help point in the right direction of who can potentially answer the questions. So I'll let Spencer take over.
Perfect. So thank you so much to the team for providing that presentation. That was really, really helpful. I do have a few that we can kick off with. And I saw that, Chunya, you provided a written response, but I think it might be good to ask the question verbally. So the question is freezing the samples before sending them out acceptable for the type of testing being done? And I don't know if Chunya, you want to answer that.
Yeah, so I can, yes. So generally, we don't recommend freezing samples. So we recommend you, once the wastewater sample is collected, and ship them in the cold pack right away. If you cannot ship right away, should store them at 4°C.
Thank you, Chunya.
And I can add on too if anyone's curious as to why. So basically the viruses are able to protect their nucleic acid, their genetic information. And so when we freeze and then thaw, that actually can cause, the best way to explain it is the viruses to explode. And they'll release all of that information and it can potentially be degraded by different things in the wastewater. So that's kind of why if we can keep them at a cold temperature and preserve them, and prevent that nucleic acid from being released until we want it to be released, that's helpful.
Thank you, Brady. The next question that I have seen is a project I am aware of is composite sampling for a series of special events. This method combines and homogenizes the samples. Is this very problematic, even though it's more cost-effective to test?
It could be. I think the question is asking to combining samples from different, let's say, pooling samples, right?
Mhm.
So that can dilute the signal in the wastewater, especially for, because for wastewater, it's very diluted, and pooling samples can make it even more diluted and can definitely miss the signal during the testing, increase the risk of missing the signal. I think that's what I can think of. And of course, pooling sample is also one of the benefits could be also diluting inhibitors. However, I think the main concern is really diluting the signals in the wastewater. Yeah, Brady and Jessica, if you have anything to add, feel free to add.
Yeah, I would say if it's a series of events, it probably won't be too problematic because if you want to just go for that average, and sometimes the majority of the time the average is best versus kind of getting those one-shot grab samples. And like Chunyi said, if it's all being pooled at once, it can be easily missed. I mean, that is the benefit of doing a concentration, is our goal is to concentrate all of our targets out into a smaller volume, but of course it's not always perfect. And so um, having a less diluted sample is better, but I think it really depends on the specific um, events and stuff, because the majority of the time we prefer composite samples if possible. I don't think there's been a situation where we've requested only grab.
Awesome, thank you. The next question I see is it an issue to store over a weekend and ship it on Monday as long as the samples are held at 4C?
I can jump in for this one. We prefer to not get samples batch, but at the same time, we understand that everyone at a utility is super busy, and this is already going out of their way to help us with this work. So our campus cannot receive any samples. um, over the weekend. So it would be more ideal to hold the samples over the weekend in the refrigerator at 4C and then ship them out on Monday.
Yeah, thank you, Jessica. That's why we recommend not to collecting sample on Friday, so avoid when you, if possible, um, make sure samples are collected bef before, I would say, shipped by Thursday and overnight so we can receive it by Friday and to avoid that holding a sample over the weekend, if all possible. So, like, we do understand for some utilities, it's just very difficult to do that logistically.
So the next question that I have is kind of what is one of the, I guess, kind of easiest pitfalls or maybe most kind of common issue that you guys run across in receiving sampling? Is it more on the packaging side? Is it more on the keeping it cold? And kind of what is that main issue? And is there something that you guys can recommend that might be a good or simple solution for that?
A lot of times we have issues actually not with utilities, but with our couriers potentially missing
Mhm.
pickups, which is not on the utilities. So I think the biggest one is if you are noticing repeat issues to reach out to us, because that we can easily solve. Like we're constantly in conversation with our couriers, um, just to make sure it's easiest for the utilities, so that they don't have to deal with these problems. So I think that is a big one of, yeah, if you notice any issues with couriers and missing pickups, to just reach out immediately, even if it's just to log it, if it was the first time, because we log every issue we see.
Mm.
And that way then we can come to a solution with hopefully minimal disruption on the utility side. Jessica might have more.
Yeah, I was gonna also add, it's something that Brady mentioned, but it's like we would like it really helps us when the utilities will reach out to us about like, for example, when it's something like we're running low on supplies, or hey, like something went wrong today, we couldn't get the sample. It's like it's just so we're all in the loop of what's going on with y'all so we can try and help. Additionally, like there are also like for example, there's like one utility who was unable to like maintain like the original sampling and shipping schedule that they proposed, and it we had they had like a log of like a month of samples because they didn't like they couldn't ship it out based on that schedule. But then when we talked with them, we were able to come up with a new schedule that like has satisfied like our needs and their needs. So I just want to emphasize like that the shared inbox emails like is the first, it's like the best place to like reach us in the laboratory, but that also like can help with circumventing some of the more common issues we see in the process.
Yeah, I think that's a really that's a good point. And just from my, experience and participation, as at the association level, in dealing with the all the different teams at CDPH, I will say you all are very attentive and responsive to emails. So that having that communication is really valuable, and especially as things are coming up, I think it's really a good use for all of us to communicate, and then that way, if there are, relatively simple issues, they can be worked out. And so one thing that I always kind of enjoy talking about is um, the real life case stories, the uses for this data. I appreciate that you guys included some of the tips and tricks from LACSD. They're a really great partner in this. And I'm just curious, do any of you have a particular use story of how this data was utilized that sticks out to you or makes you feel like, that this program is that it shows the value of this program and what it means. Because I know for a lot of utilities, um, we, are given the task of helping protect our communities, whether that's through, if we work on recycled water, if that's just, cleanup, environmental cleanup, being kind of the end of the one water circle, we kind of have that role of being the protector of our local communities and ratepayers. And so, for us, this program, the big benefit to us is that we can provide data on what's happening in our communities, and then that data gets to be, or it can be used to make real life, public health decisions. And so for me, and I can't remember where it was, but I think in San Francisco when the monkeypox was, which formerly called monkeypox. I'm sorry, I'm still on the old name. But when that outbreak was just starting, it was really the wastewater surveillance data that helped kind of provide more of a detailed glimpse into what was going on and allowed the public health officers and the local state agencies to kind of help adapt to what's going on and how we can best deal with this and track this information. So no pressure if you don't have a story, but if you do, I always like to provide an opportunity for our utility partners to hear these stories because I think sometimes there's a bit of a disconnect between collecting the samples and sending it, and then what happens with that sample once it goes on.
I okay. So we do have lots of those kind of stories. I'm sure Stephanie can also share some of the stories. Um, I can give you most recent example is we've been doing the measles pilot testing. So after the a full validation. So during the pilot testing, we definitely detect some positives measles, and for one case is we detect some positives in one of the utility, and then they have not had cases reported yet. So we reported to our API, and our API team actually worked with the immunization branch in the CDPH, and then they reached out to the local jurisdiction and informed them of the wastewater testing positive for measles. So after that, and obviously they will take actions to ramp up either with testing or just more awareness, everything, and they actually later found patient cases of measles. So that's just one of the many examples. Wastewater definitely provide an early warning and really gave the health providers, time to stop the transmission in the community.
Yeah, that's fantastic. Yeah, and measles is a great example of, it's one of these diseases that it is making a resurgence, and as scary as that is, but having this wastewater data can do exactly what you just described, which is provide that early warning and allow kind of the quick mobilization of resources and tools to make sure that we try to, stay on top of it and just data is always good. Does not matter which way you slice it. Even bad data is, if it's bad for you, but it's still good for the community, is good data. So I think that that's a really that's a great example.
I was wondering if I could also add to that too, and just say hi everyone. I'm Stephanie Birch-Murbach. I'm the program manager for our wastewater surveillance team, and help support the EPI and the laboratory teams here at CDPH. But just adding to some of those use cases for wastewater surveillance, Spencer, going back to your mpox or monkeypox example, I think in a lot of cases we will sometimes expect some of our larger cities like San Francisco or LA to have some more of these positive detections with mpox. But what we've found is really interesting with our wastewater is helping to detect it in areas that we didn't expect it. So maybe some of our smaller, more rural communities where they didn't know that this was in their community, and wastewater surveillance was able to become kind of a window into what was actually going on. And from there, the health officers in that particular county was able to help allocate resources for the healthcare system, help to get vaccines on hand, and then also to do targeted messaging for the vulnerable populations that are most impacted by mpox or monkeypox. And so that's really a great successful use of wastewater surveillance. And so, we're really dependent on our utility workers who are able to supply these samples for us so that we can then be able to use that for public health outreach. And then just even a second example would be for norovirus. And I know this was something that we mentioned in our previous webinar, but I think it's a really important way to highlight wastewater surveillance. Norovirus isn't normally a required reportable disease in our state. And so wastewater is one of those few mechanisms that we can have consistent and accurate reporting on what's happening with norovirus. And in one of the counties that happens to be tracking for it, they noticed at a local restaurant that there were some reports coming from norovirus-like symptoms, and the county was actually able to use the wastewater surveillance to understand and confirm that it was indeed norovirus, so that they could then respond and react at that local level and employ like cleaning methods, being able to shut down the restaurant, being able to do that with confidence that they knew what they were dealing with, while they waited for like clinical testing to confirm that it was noro. So a lot of great examples and use cases for wastewater. And as Chunia mentioned, being able to help highlight what's happening in our communities before they show up at, report for clinical or healthcare settings. And I think that's a unique position for wastewater, is that it's not dependent on access to healthcare or access to clinical. We are able to get this population level information, and it's anonymous data that's coming through wastewater.
Yeah, awesome. That's great. Yeah, we talked about that example in the last webinar, and I think that's a really interesting case of being able to really pinpoint what's happening in a community, and that's an important distinction too. Because the wastewater data is it's anonymous, right? It's based on your community or the area of your collection system. So that is also a difference between that and clinical testing. Is clinical is based on the individual patient being tested. And the time constraints between wastewater data and clinical data, the time frames can be much different, just because of the time it takes for you to get someone down for clinical testing and then get the results from that. So I think it's an important tool in the public health toolbox. And I see now we have a couple other questions. And this one, as a wastewater nerd and aficionado, I enjoy. Would there be a need to collect samples at particular points in the collection system? So I think, they're asking if it's at what point in the process is it the best to collect the samples?
I think we really prefer the 24-hour composite samples. Um, it is really, if you're asking if it's good to start collection in the morning or that, I don't think there is such a recommendation out there, but in general we prefer 24-hour composite sample instead of grab sample, as our speakers have mentioned.
And I would say that you would want to do sample collection at the influent before it goes, very far through the treatment process, just to get, that raw data.
Yeah, I was just going to say, I think all of our samples we do get a few grab samples, but otherwise we get all raw influence, so completely untreated, unsterilized, anything. I don't know if anybody is collecting effluent data, information from effluent water. That would be interesting to see
Mhm.
how well it works for viruses, but probably very well. But yeah, we prefer the raw influent.
And I would think once it goes through a digester, most of those viruses
Yeah.
have.
And I know some places have UV sterilization as well, and
Yeah,
that
exactly.
will work very
Hmm.
well.
Yeah. You'd get a different sample.
Mhm.
And then the next question I see is for new operators and utilities, what are some common errors that cause issues more frequently?
Maybe you guys can just talking about some common errors we encountered in terms of the COC form or during the shipping and the transition. Yeah.
I think I'm trying to think. One of the things is if thinking just about new operators, but in a utility with a established like in the program, I would say a big thing is definitely um, reaching out to whoever was doing it previously, if somebody was, and you still have contact with them. Because we have found that sometimes a new operator will come in and we'll just be like, oh, you may have missed labeling the um, we need the COC in physical form or something. And they'll be like, oh my gosh, I'm so sorry, I didn't realize that. And we'll be like, oh, it's totally fine. So I think definitely communicating with people who have been in who are helping with it previously if possible. And then I think if you're unable to, um, we'd be happy to do like a quick meet or resend everything we do just to go over how we do the shipping and stuff. Um, I think one of the things I feel like we do notice is we do always have two ice packs specifically in there because we have found that one ice pack is not enough to keep it below that 10C. So I think definitely the two ice packs is very specific. So I think making sure that everything is included in the kit and is there because it does all each have a role.
Yeah. So I want
Um,
to echo what Brady mentioned. If you do have a new operator, I know there are some turnovers. Make sure always reach out to us. We are happy to give a brief presentation, just walk the person through the process, and that's always a good start. In terms of common errors, I could add a few. What I heard from the team is, make sure you do want to have more than 40 mil, but you don't want to have more than 50 mil. So that's gonna the leaking is from time to time we encounter those type of issues for the leaking, which we do not want that to happen. Not sure if you guys have other things to add.
I have one very small thing, and it's just one thing that we find that like utilities have missed is just making sure that like the date when sample collection starts is listed and it's not the end of the 24-hour collection, which is why we tried to like clarify on our COC form for that metadata aspect. It's like it is like when does this 24-hour collection start versus when does it end, because that will ultimately impact like how it is reflected in the data presentation for trend calling.
Awesome. Yeah, I think that's all really great. And a lot of those issues are all very minor issues. So I'm happy to hear that there's not like, oh yeah, there's all these glaring issues. So to our utility partners who are engaged, sounds like you all are nailing it. So keep on doing the good work and also reach out when you have questions or if you run into any issues. And yeah, and I think with that, that is all the questions that I have seen. And so I know, we're coming up on time here, so that's great timing. I know we have a few resources that we have linked at the end, so I don't know if anybody or if Stephanie, you want to go over those. And so here we have just our acknowledgments. This here is talking about all of the people that it takes to make the Cal Sewers network exist. So huge thanks and appreciation to all of those. This is all of the utilities who are participating, providing all of this across the across the state providing data. If you are interested in participating or would just like more information, please feel free to reach out to the CDPH team. And I believe all of their, I think we have all their emails, or they have emails right there. Perfect. Um, and I will just wrap this up by saying thank you all so much for being here. We really, really appreciate your time. We know it's very busy for all of you, so we appreciate you giving us an hour here. And if it's not too much to ask, I'd like to ask for at least one more hour. On May 20th, we will be doing the third webinar in this three-part series. So if you enjoyed this and you'd like to wrap up the series, please be there with us. And if there are any questions or anything that comes up between now and then, always feel free to reach out to anybody on the CDPH team, or you can reach out to myself, and I'd be happy to connect you where I can. And so before I close it out, is there anything else anybody else wants to add?
Hi, Spencer. I just want to add one more thing. I want to say really a big thank you to all the utility partners who has been participating in this program, providing samples for us. Really, we cannot produce good data without the good sample you submit. So your contribution is key, and we really appreciate that. Thank you.
Awesome. Well, thank you all so much, and I hope to see you on the next one. So thank you all.